Let me tell you about a woman named Helen. She was 71 years old, a retired school principal from Virginia, sharp and independent, the kind of person who paid attention to details. Helen had watched her older sister go through kidney disease in her late 60s, and the experience had stayed with her. She did not want that for herself, but she also did not want to spend her retirement in and out of doctors' offices chasing problems. She wanted to know what she could do every single day in her own home with her own choices to protect the organs that were quietly doing some of the most important work in her body. So she started asking questions, not just any questions. She started asking her physician what the research actually said, and what she found surprised her, not because the answers were complicated, because they were not. They were 5 simple daily habits, backed by published science, that most seniors have never been told about in a single clear conversation. This video is that conversation. My name is Dr. Franklin, and this channel exists for one purpose: to give adults over 60 the information the system does not always have time to deliver. Today I am walking you through 5 daily habits that have been studied in peer-reviewed research, specifically in adults over 65, and shown to meaningfully protect kidney and liver function. These are not theories. These are not trends. These are evidence-based practices that your body can benefit from starting today. And I want to say clearly before we begin, these habits are not a replacement for medical care. If you have a known kidney or liver condition, your physician's guidance always comes first. What these habits represent is the best that lifestyle science has to offer for the aging body, and that science is genuinely worth knowing. Stay with me through all 5, because number 1 is the habit that surprised me the most when I reviewed the research behind it. It is something almost every senior does, or does not do, every single day, and the difference it makes to kidney function over time is more significant than most people realize. Drop a comment below right now. Tell me, are you over 65? Which of your organs do you worry about most? Your kidneys, your liver, or both? I read every single comment, and your answer helps me understand what to cover next. Alright, let us begin. Habit number 5, moving your body consistently every single day, even gently. Let me be precise about what the research actually says here, because this is not about running marathons or going to a gym. This is about what happens inside your kidneys when your body moves regularly, even at a modest pace. Your kidneys receive approximately 20 to 25% of your heart's output with every single beat. That means that everything affecting your heart and circulation also directly affects how well your kidneys are being perfused and supported. When you are sedentary for long periods, circulation slows, blood flow to the kidneys becomes less efficient, the filtration pressure inside the glomeruli, the tiny filtering units of your kidneys, drops. And over time, chronically reduced kidney perfusion contributes to the gradual scarring and functional decline that is one of the defining features of chronic kidney disease in older adults. A nationwide population-based cohort study published in PMC followed adults aged 65 and over and found that physically active older adults had a 19% lower risk of significant GFR decline compared to inactive adults. That means regular physical activity was independently protective of kidney function, separate from any other health factor, including blood pressure, diabetes status, or body weight. A separate cross-sectional study from the Taipei City Elderly Health Examination database found that regular exercise was associated with a significantly reduced likelihood of reduced GFR in older adults, and critically, that protective effect held regardless of whether the person had high blood pressure, diabetes, or obesity. The protection was not dependent on being otherwise healthy. It was present even in older adults with chronic conditions. What does this look like in practice? A 30-minute daily walk at a comfortable pace? Gentle water aerobics, chair-based movement routines, Tai Chi, which has the added benefit of improving balance and reducing fall risk. The research does not require intensity. It requires consistency. And for the liver, the connection is equally clear. Adonichar, study in nutrition and diabetes, found that physical inactivity was independently associated with a significantly increased prevalence of metabolic fatty liver disease, the most common form of liver damage in adults over 60, even after controlling for diet and other lifestyle factors. Simply put, a body that moves regularly gives its liver a measurably better metabolic environment to work in. What to do starting today? Choose one movement that feels manageable and comfortable for your joints and fitness level. Do it every day, even on the days when it is only 10 minutes. Consistency matters more than intensity. And if you have any joint conditions, heart conditions, or balance concerns, speak with your physician about what movement is right for your specific situation before beginning. Habit number 4, drinking plain water steadily throughout the day rather than in large amounts at once. This one requires more precision than most people expect, because the research on hydration and kidneys is more nuanced than simply drink more water. Here's what the science shows. Dehydration is extraordinarily common in adults over 65, for a reason most people do not know. After the age of 60, the body's natural thirst mechanism becomes significantly less sensitive. You can be meaningfully dehydrated without feeling thirsty. A 2023 review published in the journal Nutrients confirmed that dehydration is prevalent in adults aged 65 and older and is an independent factor associated with poor kidney function outcomes, longer hospital stays, and higher rates of acute kidney injury. When the body is chronically even mildly dehydrated, blood volume drops. Lower blood volume means lower kidney perfusion pressure. The kidneys have to work harder to filter a smaller, more concentrated blood volume, producing more concentrated urine and placing more metabolic stress on the tubular cells that do the fine work of filtration and reabsorption. A NIH-published review on hydration and kidney health found that low intake of plain water specifically was associated with a significantly higher odds ratio for chronic kidney disease in large community-based samples. Notably, the protective effect was specific to plain water. Beverages with added sugar or excessive additives did not show the same protective relationship. However, and this is critically important for seniors with heart or kidney conditions, more is not automatically better. The same research found a U-shaped relationship between water intake and kidney outcomes in people with existing kidney disease. Both too little and too much fluid can be problematic. This is why your individual fluid target should always be discussed with your physician if you have any heart, kidney, or fluid regulation concerns. For generally healthy adults over 65, the evidence points towards steady, consistent hydration throughout the day as the most protective pattern. Small amounts regularly rather than large amounts at once. A glass of plain water with each meal. A glass in the mid-morning and mid-afternoon. Fruits and vegetables with high water content as part of meals. What to do starting today. Place a small glass of water in a visible spot in your kitchen and refill it consistently. Throughout the day, eat 1 or 2 pieces of water-rich fruit daily. And if you currently take medications that affect fluid balance, speak with your doctor about the right daily fluid target specifically for you. Habit number 3, prioritizing 7 to 8 hours of consistent quality sleep every night. This one surprises people almost every single time, because sleep feels entirely unrelated to kidney and liver health. Most people think of sleep as being about the brain, about energy and mood. The research tells a very different story. During sleep, your body undergoes a cascade of restorative processes that directly involve your kidneys and liver. Kidney filtration rate actually follows a circadian rhythm, dropping during the night to allow the organ to rest and repair. When sleep is chronically disrupted, this repair cycle is interrupted. Research has shown that even a single night of sleep deprivation alters systemic antioxidant levels, including glutathione, which is the liver's primary protective molecule against oxidative damage from metabolic processes for the liver specifically. Study published in the International Journal of Clinical Practice found that older patients with obstructive sleep apnea, a condition that disrupts sleep quality even when total sleep hours appear adequate, had a significantly increased risk of liver injury and fatty liver disease. The mechanism is reduced oxygen delivery to liver tissue during sleep-disrupted breathing, combined with the hormonal disruption that poor sleep causes in fat metabolism, and insulin signaling for the kidneys. Cross-sectional study found that poor sleep quality in older adults was associated with measurably worse kidney function markers compared to age-matched adults with consistent quality sleep, even after controlling for other health variables. The practical implication is significant. Sleep is not just recovery time for the brain. It is when your liver processes the metabolic work of the day and prepares for the next. It is when your kidneys rest and repair their filtering structures. Consistently shortchanging that window has cumulative consequences for both organs over years and decades. What to do starting today. Establish a consistent sleep and wake time 7 days a week, including weekends. Keep your bedroom cool, dark, and quiet. Avoid screens for at least 30 minutes before sleep. Avoid large meals within 2 hours of bedtime. And if you snore heavily, wake frequently in the night, or feel unrefreshed despite adequate hours in bed, speak with your doctor about whether a sleep evaluation would be appropriate. Untreated sleep apnea is one of the most underdiagnosed contributors to liver and kidney stress in older adults. If you are still with me and finding this valuable, type the number 3 in the comments right now. It helps me understand who is watching and helps this information reach more seniors who need it. Habit number 2, shifting your diet toward more plants, more color, and less processed sodium. I want to be careful here because dietary advice is one of the most overgeneralized areas in all of senior health. So let me be specific about what the research actually shows for kidneys and liver specifically in adults over 60. A prospective cohort study published in the journal Nutrients in 2022 followed 975 community-dwelling adults aged 60 and older for 6.5 years and measured their dietary patterns against their kidney function decline. The study found that adults with the highest adherence to a Mediterranean-style dietary pattern, meaning more vegetables, fruits, legumes, whole grains, fish, and olive oil, with less red meat and less processed food, had a 48% lower risk of kidney function decline compared to those with the lowest dietary pattern scores. That is not a modest association. That is nearly half the risk. The mechanism operates through multiple pathways. A plant-forward diet reduces the dietary acid load on the kidneys. Modern Western diets, heavy in processed foods, refined grains and animal protein, produce more acid that the kidneys must buffer and excrete. Over decades in aging kidneys, this chronic acid load contributes to progressive functional decline. A diet rich in vegetables and fruits naturally produces an alkaline load that the kidneys manage far more easily. For the liver, dietary sodium from processed and packaged foods is a direct contributor to the metabolic burden. Excess sodium drives fluid retention, raises blood pressure, and forces both the kidneys and the liver to work harder to maintain fluid and electrolyte balance. Multiple studies have confirmed that reducing processed food intake in older adults produces measurable improvements in both liver, enzyme levels, and kidney filtration. Markers within months. Crucially, this is not about perfection. The research on Mediterranean dietary patterns shows that even moderate improvement in dietary quality, moving from low adherence to moderate adherence, produce significant protective effects on kidney function. You do not need to overhaul everything at once. What to do starting today? Add 1 additional serving of vegetables to 1 meal per day. Replace 1 processed or packaged snack with a whole food alternative, a piece of fruit, a small handful of nuts, a boiled egg. Read the sodium content on 3 products in your kitchen that you use regularly. These are starting points, not a complete dietary prescription. And if you have specific kidney or liver conditions, always work with a registered dietitian who understands aging physiology before making significant dietary changes. Habit number 1, having a complete kidney and liver function. Panel reviewed with your doctor at least once a year. I told you this one would surprise you because it is not a food, it is not an exercise, it is not a sleep routine. It is a conversation. And it may be the single most protective habit on this entire list. Here is why. Both the kidneys and the liver are clinically described as silent organs. They do not send pain signals in the early stages of damage. They do not produce obvious symptoms when their function begins to decline. The kidney can lose up to 40% of its filtration capacity before a person feels anything noticeably wrong. The liver, with its remarkable regenerative capacity, can sustain significant damage and still maintain enough function to appear normal in daily life. The only reliable early warning system available to you is the blood and urine test, a panel that measures how these organs are actually performing. For the kidneys, this means GFR, serum creatinine, BUN, and a urine test for albumin, which is an early and sensitive marker of kidney stress that appears before GFR even begins to decline noticeably. For the liver, this means ALT and AST, the enzyme markers that reflect whether liver cells are being stressed or damaged. These tests are straightforward, inexpensive, and covered by most insurance plans as part of routine annual care. And yet, research consistently shows that a significant proportion of older adults with early-stage chronic kidney disease and early liver stress have never had these specific tests reviewed with their physician in the context of their lifestyle and habits. Helen, the woman I told you about at the beginning of this video, made this her first habit. She asked for a complete kidney and liver function panel at her annual appointment, and she asked her physician to walk her through the numbers with her, not just to note them in her chart, to actually explain what they meant and what trends to watch for. That conversation gave her a baseline. And every year since, she has been able to see that her habits are working, that her GFR is stable, that her liver enzymes are normal, that the choices she is making every day are showing up in her body's actual biology. That is what this habit gives you. Not just information, evidence that the other 4 habits on this list are doing what the research says they should do inside your body, in your specific situation, at your specific age. What to do starting today. At your very next doctor's appointment, ask for a kidney function panel and a liver function panel if one has not been done in the past year. Ask your physician to go over the results with you in plain language. Ask what your GFR trend has been over the past several years. Ask what a healthy range looks like for your age. And then take those numbers home and put them somewhere you will see them. Because what gets measured gets protected. Here is what ties all 5 of these habits together. None of them is a dramatic intervention. None of them requires a prescription, a specialist referral, or a significant expense. What they require is consistency. And the reason consistency is so powerful for kidney and liver health in older adults is that these are organs that respond to cumulative conditions over time. They are damaged by cumulative stress over years, and they are protected by cumulative care over years. Helen is 74 now, 3 years after she started paying attention to these 5 habits. Her GFR is stable at 72, a number her nephrologist describes as excellent for her age. Her liver enzymes are normal. She sleeps 7 hours a night consistently. She walks for 30 minutes every morning. She drinks plain water steadily throughout the day. She eats more vegetables and less processed food than she did 3 years ago. Not perfectly, consistently. Her doctor told her at her last appointment that her kidney function is tracking better than most people her age. She told him she had done her research, and she had The research exists. The habits are clear. The only thing standing between most seniors and this outcome is the conversation, the one this video is trying to start. If this gave you something meaningful to take into your week, please subscribe. I make videos like this every single week, evidence-based, honest, and built specifically for adults over 60 who deserve real information about their own bodies without the noise. And leave a comment below. Which of these 5 habits is hardest for you right now? Your answer helps me understand what to cover next. And it might be the exact thing someone else watching today needed to hear. Take care of yourselves. I will see you in the next one.